I'd like to invite our next presenter up, Greg Oudman from Health Initiative for Men, and Misty Bath. Oh, that's not what you want. I'm changing your slideshow, sorry. I'll change it back. Okay, there you go.
Okay, so I am going to, there we go. Yeah. A couple of disclosures. I'm a technological Luddite, so I printed off my notes because I wasn't sure I'd be able to see any notes here. I didn't trust the system, so I'd rather go with my own system. So you may see me reading my notes. I'd like to introduce my partner in crime, Misty Bath from Vancouver Coastal Health. She can talk a little bit about what her role is in this relationship. My name is Greg, and I'm the Executive Director of Health Initiative for Men. I've been with Health Initiative for Men for 4 years, and I'd like to thank CBRC, I think, for giving us the opportunity to do this presentation, because it doesn't really fit with the theme of the summit, but we're celebrating 10 years of our existence this year, and we thought it'd be a great opportunity to kind of talk a little bit about I think what I believe to be some of the relatively unique characteristics of Vancouver and the Vancouver paradigm and our relationship with Vancouver Coastal Health that allowed Health Initiative for Men to develop. So without further ado, let's try and click through here. No, that didn't work. No. Space bar. There we go. So, setting the stage. I'd like to talk a little bit about, I think, Vancouver and what makes, we believe, what makes Vancouver to be a little bit unique in terms of setting the stage for an organization like Health Initiative for Men. So after Expo 86, there was rapid urban growth in Vancouver, and this rapid urban growth included a concentration of gay men from across Canada moving to Vancouver. Misty's going to talk a little bit about the changing face of HIV. Mm-hmm. Care and prevention. So
to really kind of help lay a little bit of a context of how the health authority became a bit more involved with the Health Initiative for Men, I might have to do just like a very brief history lesson just to share with you where we came from. So for folks that are BC based, I apologize for this, but in 2010, the BC Centre for Excellence, oops. This is where, yeah, we can. Oh. Sorry. There we go. Okay, so in 2010, the BC Centre for Excellence in HIV was successful in pitching for and actually acquiring significant pilot funding in the tune of $48 million to initially scope out and test the concept of treatment as prevention, so TASP, which we're all really quite familiar with. And so we were given a 4-year period in demonstrating the impact of that concept. And as to add to that history lesson, that pilot was initially scoped out for the downtown east side as well as Prince George. And we were specifically looking at injection drug use risk, which for many years, as you all know, was the primary driver of our local epidemic here in Vancouver. But as the pilot progressed and after some significant lobbying, the Ministry of Health eventually agreed, you know what, let's expand the scope of the pilot. We should include all of urban Vancouver and take a look at other HIV risk, including folks who were living at risk in the GBMSM community. So the injection of this large amount of funding dollars really enabled health authority partners such as VCH, the BC Centre for Disease Control, PHC, which is Providence Healthcare, to work with community ASOs and CBOs to revision and redesign our continuum of HIV care. So really we wanted to have a comprehensive integrated system of care where we moved away from patchwork funding, patchwork services to something that was a lot more integrated and consolidated. So essentially we really tested out pilots or interventions that were fitting in streams along the continuum. So we really focused on prevention activities, testing activities, treatment and care, and linkage and retention in care. So pre-pilot, we had a bunch of different funding streams, random things that were funded in the community to support HIV prevention and treatment initiatives, but they were siloed. They weren't working together, they weren't communicating, and there was very minimal population level impact. Post pilot, we moved to a phase where the health authority clearly funded contracts with community-based organizations and ASOs that clearly aligned along that continuum. So from prevention, testing, treatment, and care. And directly what that meant was that some ASOs and CBOs lost their funding because they weren't able to change their activities or services to align along the continuum. And others, and I would say Health Initiative for Men is an example, really benefited from that change in funding mechanisms and the way that we funded HIV services in this city, because they were able to show us how their activities and their interventions clearly lined up along the continuum of care. And also, because we're a health authority, we do like to think that we make evidence-based and informed decisions specific to healthcare service planning and delivery. And certainly during the STOP pilot, and even to this current date, the local driver of our HIV epidemic moved away from people who use drugs to at-risk folks in the GBMSM community. And that was also paired with epi surveillance data that showed us, we also were seeing similar trends for rising cases of STIs in the population, namely syphilis and gonorrhea. That was also mirrored in national and international level data. And that really cemented our rationale with the health authority about why we needed to pay specific attention and targeted attention to at-risk folks in the GBMSM community, and why, more importantly, we needed to work with players in the community who knew their community, knew the needs of their community, and who could come and sit at the table with us to plan some targeted interventions that were innovative and different to kind of hopefully change the curve of the epidemic for the GBMSM community. So that's a little bit of a health authority perspective for why we were wanting to engage with partners like him.
So back to the context a little bit. So while these conversations were happening with Vancouver Coastal Health, some of the other characteristics that made Vancouver a little bit unique were that Vancouver was kind of seen as a harm reduction capital in BC. Early adopters of the benefit maximization principle, adoption of the 4 pillars approach to harm reduction, and I believe development of extensive and avant-garde harm reduction programs and infrastructure as a result. For example, the Center for Excellence distributing ARVs so guys wouldn't resist going to get them from other places. I think that harm reduction kind of set the stage for an organization like Health Initiative for Men to develop. And I also believe that Vancouver and BC has a strong and progressive public health infrastructure. So in that context, in that setting, I'd like to again give a shout out to CBRC, because I think the Sex Now survey that began in 2002 and the data that started to be gathered and early iterations of that survey showed significant support for a standalone gay men's health organization. The evidence was there in plain sight. That survey data was consistently presented at the earliest summits, 2005, 2006, and 2007, and those summits really urged an increase in focus on HIV and AIDS prevention, so much so that papers were filed to incorporate Health Initiative for Men provincially just days after the 2007 summit. All right, let's try this, see if this works. So, drivers. I think one of the other things that led to the evolution of Health Initiative for Men were gay men's voices coming to the table. At Health Initiative for Men, we have our original board, Carl Bogner, Rick Marchand, I think he's in the room back there, Terry Trussler, Rob Gare, Michael Quagg, Noah Stewart, Richard O'Donnell. These were really important players, really important people that came to the table to advocate and have a very strong voice for the development of gay men's health services. Influential first staff, the inaugural executive director of Health Initiative, sitting right there, Philip Banks, people like Jody Dollamore, Wayne Robert, my predecessor. These were really influential people that fought really hard and made a case for the development of specific gay men's health services. Community champions at VCH and Providence Health, people like Chris Buckner, Miranda Compton, Scott Harrison were individuals who believed strongly in the mandate of Health Initiative for Men and helped push us along. And then there were some examples that we were seeing in the larger gay community that helped us make a case for gay men's health approach to prevention. the paper, Valuing Gay Men's Lives, that was written by Jens Hellquist in Saskatoon, kind of provided a bit of a foundation for the development of a population health approach or prevention approach to gay men's health, and really kind of looking at gay men's health not just through the lens of HIV prevention, but through a larger integrated lens. And then even after Health Initiative for Men was founded, we found that gay men were still sometimes being left out of the HIV prevention paradigm, as STOP continued to focus primarily on other populations in the downtown east side. So when the STOP mandate expanded, which Misty talked about, there was a cry to get more support for gay men's health and prevention services, and Wayne Robert, my predecessor, played a large role in making a strong business case for that. Want to speak a little bit more? No? Okay. All right. So now I'm going to try to see if this works. So I wanted to illustrate, I guess, a sense of what I believe to be the unique characteristics that were in existence in Vancouver and BC to allow Health Initiative for Men to develop. So we have the community action that was happening, advocacy, specific people, community heroes, losses, significant number of people being lost to HIV that caused movement among the community. Then there were healthcare organizations. From the beginning, partnerships with health authorities and organizations were intentional and non-adversarial, and relationships were really being built. And then we had research. So these are the three. I've got 5 minutes, all right. These are the three pillars that really kind of led to the formulation of Health Initiative for Men. And the interaction between those three pillars, I think, brought some unique characteristics into play. The advocacy between the community and the healthcare organizations. Individuals in the community were advocating strongly with healthcare organizations for a response and responsive programming to address gay men's health. There were multiple sources of evidence. The research that was being done in the research community were supporting, and in the healthcare organizations were supporting the development of an organization like Health Initiative for Men. And then community-based research. So one of the unique characteristics that was available to us and we saw back then, 10 years ago, was community-based research. Research that wasn't strictly epidemiological or strictly health authority focused, but organizations like CBRC and Pacific AIDS Network were doing CBR that had kind of a community focus to it. So all of those things actually led to I think the unique perfect storm, I believe, that allowed Health Initiative for Men to form 10 years ago. All right. So in 2003, way back in 2003, AIDS Vancouver held a focus group that suggested gay men were tired of being seen exclusively through the lens of HIV. That same year, 2003, Gayway was launched by AIDS Vancouver, which was designed to create more meaningful connections between gay men and while promoting better health. The Gayway program was transferred to Health Initiative for Men in 2009 or 2008, and then HIM opened an office in the Davie Village. Health Initiative for Men, our mission, gay men building healthy lives together, strengthening the health and well-being of gay men. So here's a little bit more about Health Initiative for Men. Our values, we value the ability for gay men to make informed decisions. We value the role of our communities. We value scientific research. We strongly value a non-judgmental, sex-positive, and strengths-based philosophy. We value a comprehensive approach to healthy living, and we value capacity building and collaboration. At HIM, we have an integrated, I'm in the right slide. At HIM, we have an integrated approach to health focused on the determinants of health: physical, sexual, social, and mental health. We chose how we would do prevention. We knew that in order to make a significant difference, we would need to capture more than just biomedical interventions and scientific research. We needed science, hold on, I'm scrolling down here. We needed science, community, support, friendship, and everything in between. This philosophy is embodied in every program and offering in Health Initiative for Men. While some programs might seem purely focused on science and medicine, we demonstrate the 4 pillars model. I don't know how, I'm gonna switch to my notes. We demonstrate the 4 pillars model by making sure that our nurses have relationship with. These are personal relationships that we have with our nurses. Our volunteers represent our community. They serve their community. They're mutually beneficial relationships. Our board is a group of gay men willing to do this work within their own communities. Our groups hold spaces for gay guys to be themselves. And we talk about sexual health in groups too. We practice, we believe, what to be 360 degrees of health. Oh boy. All right. That leads us to the quick discussion that we're going to have around our health centers. So there was a rapid expansion of health centers, both outside of the Davie Village on the Drive and in the Fraser region. And in a way, we were victims of our own success. Limited space and capacity led to a consistent number of turnaways, with at least 25% of guys who showed up for testing not being able to be seen. An expansion conversation began with Miranda Compton, Misty's predecessor, and myself in December 2015, and it really was a perfect storm. VCH was looking for additional space, and HIM was looking to expand its capacity. We had a broad visioning session in January 2016. People present included community and public health stakeholders, Vancouver Coastal, Providence Health, Provincial Health Services Authority, BCCDC, and community stakeholders like YouthCo and CBRC. The idea of an integrated gay men's health center started taking shape. Did I skip? No, there we go. Oh, it didn't show up. All right. Misty.
Yeah, I'll be so quick here. So again, just as the regional manager of HIV services, some of the considerations that we took into effect before we actually jumped off a cliff with him, because before we had a contractual relationship. So we had contracts from 2009, but come 2016 we sort of were like, okay, we're going to go in, and we're going to go in really deep, and there's no way of turning back now. But we wouldn't have done that if there weren't some key considerations, and one was we had a proven track record. So we already had contracts with him, and with the health authority, we can't just give money and say peace out, do what you want with it. Actually, there are some there's some accountability for how that funding is used, and I'm looking at Robin because I actually have to tell Robin how I use my money with the ministry. So what that means is that we would meet regularly with Greg and the rest of the HIM team and talk a little bit about their budgets, about their operational challenges, about progress towards deliverables, and clearly they were meeting all of our expectations, and we really didn't have any concerns. We also had successful mini pilots of collaboration, so we had already embarked in the current state with embedding some of our health authority clinical staff with HIM staff. That included our nurses, our nurse practitioner, and our counselor. And so we were able to actually work really well together. And there was already some successful pilots of that happening. We had the common shared vision, which Greg just talked about. And I think more importantly, we felt quite confident that there was ongoing commitment to work in partnership together. So as a health authority, we knew that we could come to the table with him, talk about challenges, and actually solution those things together. And that's really reassuring because there's a lot of gray when you're starting something new. So yeah, I would say that that's where the dash of good old-fashioned faith comes in.
I'm just going to leave you with a diagram that gives you a sense of what we believed to be at the time in February 2016 what we called an integrated gay men's health center. And really, all the little bubbles around the center image give you a sense of the various programming that's available at the HIM on Davie Health Center for sure, which is our flagship center, but certainly we're looking to provide those programming in all of our other health centers as well, and we're well on our way to doing that. So on that note, thank you very much.